This is a common one we've gotten repeatedly. Could you get one of the medical experts to walk through clearly the symptoms of likely COVID and those that are more likely a cold or regular flu or allergies? We need better help telling the difference.
Sorry. They're very much the same. So the most common symptom for COVID-19 is fever, sore throat sometimes, shortness of breath sometimes. You can have a cold, very occasionally been reported diarrhea, and you can see those symptoms are pretty non-specific. You can have some muscle aches, too. All of those things can overlap with regular flu, and so it's very hard to distinguish the two of them.
So when does the phone call get made?
Well, I think it's real. I think that's a really important question. If you have some of these symptoms, I think you should isolate yourself and see if they go away relatively quickly. And if they don't, then I think you call. The usual 14-day isolation, I think, is probably, that's for a suspected exposure to this case. But I think it highlights a problem, which is distinguishing people, and many people don't know that they've actually had COVID-19 because they either don't have any symptoms or mild symptoms that can overlap with lots of other viral conditions.
Right, and at the same time as we're trying to figure out these symptoms, we have people with real-life health situations where they need answers on kind of a timeline. Here's a question, Dr. Davidson, that might be good for you to answer. One of our viewers wrote, I am nervous about walking into a hospital tomorrow for a mammogram and sonogram. I need this exam due to breast pain. Hospitals are full of sick people, and the mammogram team will be right on top of me. Should I be concerned? Dr. Davidson?
I think it's incredibly important for people to get mammograms when they need them. So, I would trust your local hospital that they are taking every precaution so that any staff members that are potential risk are not caring for patients, and that certainly any patients that are potential risk that are at the hospital are not interacting with well individuals. So I would tell that person they should feel comfortable. And if they're concerned, they can call the hospital and just ensure that those measures have been taken.
Well, I think it's also worth noting, Dr. Davidson, that the hospitals are taking some measures to reduce the overall number of people in the hospital. I have a doctor's appointment next week, and one of the things I've been hearing on an automated message is, you can only bring one visitor with you at a time. We're limiting the number of people in the emergency room. So it seems like hospitals, some of them anyway, are taking that step now.
Right, and we're encouraging people, if you are relatively well, even with symptoms that you think could be COVID, don't just rush into the hospital.
Right.
I worked last night, overnight shift in the ER, and I saw 5 different patients, one of whom was relatively ill, but in a general sense, the other 4 weren't, but they were all just really nervous. And 2 of them directly asked me, do you think this is the coronavirus? And, we don't have tests. We can't test those people. They haven't been exposed to anyone because they only have 12 positive tests in Michigan because we haven't been testing, the real world impact of not testing for the past 6 weeks. So, I would urge people to also not clog up the emergency departments that way.
Dr. Davidson, I actually have a question for you. As a doctor, have you been able to get tested? Are doctors and nurses and staff being tested?
We're not being tested routinely. Certainly, if we came in contact with a suspected COVID patient, then we develop symptoms. First would be self-isolation. But, we have a process to pull people out of the workforce. That's, again, the big concern with not testing. We may come into contact with people who are positive. We just don't know it. And the current guidelines suggest either you have travel from one of the listed countries, which to me doesn't make sense anymore since it's here. We know it's here and we have our own hotspots. Or if you've been exposed to a positive patient. What I'll tell you for myself, I've changed my practice. I always put on a mask in every room before I go in, a regular surgical mask. I put on gloves, and I pretty much sit by the door at least 6 feet away from my patients when I'm getting their history, when I'm going through their discharge, and I approach the patient and I tell them very directly, I am keeping my distance for your sake and for mine because you don't want to get me sick and I don't want to get you sick, and we want to try to stop the spread of this thing, and they're appreciative and they like to know that that's what we're doing.
Dr. Fair, a lot of the questions we get are about, are we tracking this properly? Here's one. It has been reported that many people with COVID-19 are asymptomatic. if this is true, how does limiting testing to only people with symptoms make sense?
Well, if you're asymptomatic, we have no reason to believe that you're sick in the first place. That's the problem. And then, of course, you've all heard about the shortage of testing. So we are prioritizing the very high-risk groups that do develop symptoms. So it's the elderly, it's the underlying conditions, the diabetes, heart disease, any kind of pulmonary disease, et cetera. And by the way, we do lead the world in those underlying conditions with our lifestyles in this nation. So that's problematic to not have a test plus be the world leader in all of those underlying conditions.